Tactinal is a medication that is commonly used to relieve mild to moderate pain, such as headaches, menstrual periods, toothaches, backaches, and pain from conditions like osteoarthritis or cold/flu. It can also be taken to reduce fever. The recommended dosage for adults is 325 to 650 milligrams every 4 to 6 hours, as needed. It's important to follow the instructions on the label or as directed by your doctor. Tactinal can be taken with or without food, but if you experience stomach upset, taking it with food may help. It's best to take Tactinal as soon as you feel pain or fever coming on for the best results. When taking Tactinal, it's important to follow the directions on the product package. Make sure to read the dosing instructions carefully as there are many different brands and forms of acetaminophen available, and the amount of acetaminophen may vary between products. It's crucial not to exceed the recommended dosage. If you're giving Tactinal to a child, be sure to use a product specifically meant for children and use their weight to find the right dose. If you don't know your child's weight, you can use their age. For suspensions, remember to shake the medication well before each dose and measure the liquid medication with the provided dose measuring spoon/dropper/syringe to ensure you have the correct dose. Do not use a household spoon. Pain medications work best if they are used as soon as the first signs of pain occur. It's important not to wait until the symptoms have worsened, as the medication may not work as effectively. And remember, do not take Tactinal for fever for more than 3 days unless directed by your doctor. For adults, do not take this product for pain for more than 10 days, 5 days in children, unless directed by your doctor. If you believe you may have a serious medical problem, seek medical help right away. If you experience any unusual effects, be sure to contact your doctor or pharmacist right away. Your doctor has determined that the benefit of using Tactinal outweighs the risk of side effects. Most people who use this medication do not experience serious side effects. While it is rare, a very serious allergic reaction to Tactinal can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects. If you experience any other effects, be sure to contact your doctor or pharmacist. In the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Taking too much acetaminophen can lead to serious, possibly fatal, liver disease. Adults should not take more than 4,000 milligrams, 4 grams, of acetaminophen a day. People with liver problems and children should take less acetaminophen. It's important to ask your doctor or pharmacist how much acetaminophen is safe for you. Do not use Tactinal with any other drug containing acetaminophen without asking your doctor or pharmacist first. Acetaminophen can be found in many non-prescription and prescription medications, such as pain/fever drugs or cough and cold products. Make sure to check the labels on all your medicines to see if they contain acetaminophen, and ask your pharmacist if you are unsure. If you take too much acetaminophen, overdose, it's important to get medical help right away, even if you feel well. Overdose symptoms may include nausea, vomiting, loss of appetite, sweating, stomach/abdominal pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, can lead to liver damage. It's best to avoid alcohol while taking Tactinal. Before taking Tactinal, make sure to tell your doctor or pharmacist if you have any allergies, as this product may contain inactive ingredients that could cause allergic reactions. It's also important to inform them about any history of liver disease or regular use of alcohol. If you are diabetic, have phenylketonuria, PKU, or need to limit sugar or aspartame in your diet, be cautious when using liquid products, chewable tablets, or dissolving/effervescent tablets and powders containing Tactinal. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to consider these factors when using Tactinal to ensure your safety and well-being. Remember to always follow your doctor's guidance for the best time to take this medication and the appropriate daily dosage. It's important to be aware of potential drug interactions with Tactinal, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Tactinal may interact with products such as ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, potentially causing false results. It's important to inform lab personnel and all your doctors that you are taking Tactinal. When it comes to taking Tactinal, it's important to follow your doctor's recommendations for the daily dosage and the optimal timing for taking the medication. If someone has taken too much Tactinal and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the US, you can call your local poison control center at 1-800-222-1222. Canadian residents can reach out to their provincial poison control center. Signs of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme fatigue, yellowing of the eyes or skin, and dark urine. If you or someone you know is experiencing any of these symptoms after taking Tactinal, seek medical help immediately. Acetaminophen, also known as Tactinal, is a medication that does not cause stomach and intestinal ulcers like other pain relievers such as aspirin, ibuprofen, and naproxen. It does not reduce swelling like these other medications do. It is important to consult your doctor to determine if Tactinal is the right medication for you, and to get more information about its uses and benefits. The daily dosage of Tactinal should be determined by your doctor, and it is important to take it as directed. Tactinal can be taken with or without food, but it is best to take it at the same time every day. If you are taking Tactinal on a regular schedule and you happen to miss a dose, take it as soon as you remember. If it is close to the time of your next dose, it's okay to skip the missed dose. Simply take your next dose at the regular time. Do not take a double dose to make up for the missed one. When storing Tactinal, make sure to keep it at room temperature and away from light and moisture. It's important to store it in a place other than the bathroom and to keep it out of reach of children and pets. When it comes to disposing of Tactinal, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.